My name's Cameron Strong. I'm one of the fourth year residents in the Med-Psych program at Duke. Initially I wanted to do categorical internal medicine, and I was even thinking of specializing in GI. And then during my clerkship in my third year of medical school in Texas, I had my first exposure to psychiatry, and I really enjoyed getting to speak with patients. I really enjoyed the pathology. I really enjoyed the medications that you got to use, and someone introduced me to the idea of Med-Psych. And I didn't know it was even a training opportunity. Went to a Med-Psych conference in Chicago where I met some of the actual faculty at Duke for the first time and got to learn that really these were my people, right? And they got to think about medicine, they got to think about how people think, and a lot of cool pathology that you really only get access to in Med-Psych. And so I went ahead and pursued applying into Med-Psych programs, and then found my home at Duke. The application process can seem daunting because you kind of have to look at two programs, or at least two departments, but in essence the Med-Psych residents at every program across the country can really help sell the program for you. And so they can tell you about what the training culture is like, they can tell you what they get to see, where they get to train. And so the application process seemed daunting, but it ended up being very accessible. And some of the resources that you have to you besides every individual program across the country is also the Association of Medicine and Psychiatry, which can connect you with trainees and faculty from across the country. We have a brand new building which for pretty much all specialties, and then we have a brand new psychiatry building which is unique for our department itself. And that has allowed trainees to kind of like come together and be in like a single place. We've adapted to the pandemic situation with a lot of telehealth opportunities, which has connected patients and actually granted access to people who might not have had access to care before. And there's plenty of educational opportunities. The medicine department is very strong in encouraging people to come to conference and have and even like present themselves as residents. And the psychiatry program has dedicated time for didactics, which I think is pretty unique and very special and important to have like protected time where you're not holding a pager at all, and you just get to learn from experts in the field. The best thing about Med-Psych training, besides the people and the patients, is when you're in one department and people just like know who you are, and you get to kind of like wear your hat a little bit from the other side. So when I'm on medicine and getting to help out with psychiatry type things, or how I think about a patient in a different way, or on the opposite side when I'm on psychiatry and noticing things about their medical care that might actually be important to their psychiatric and behavioral health care. And I feel like I'm respected uniquely for that aspect of my training. Talk to the residents. The residents are going to be your key into understanding what an actual training program is like. And with Med-Psych, every year is very different. And so hopefully you have a chance to talk to people ranging from year 1 to year 5. So yeah, just absolutely use the residents as your resource, because they're going to be your key to understanding what training's like and what you can get out of it.